Today we are going to talk about special needs of Sikh patients in healthcare. First, let me introduce the religion Sikhism. Sikhism was founded in the 15th century in northern India and is the world's fifth largest religion. It is practiced in many countries around the world, and its traditions and teachings are associated with the history, society, and culture of the Punjab region in India and Pakistan. Because of this personal variation, it is important that healthcare providers consult the patient about their personal level of religious observance and practice. However, Sikh patients should not be regarded as a special group that requires additional attention from healthcare providers. Due to the common Sikh beliefs of karma and reincarnation, Sikh patients may display acceptance of difficult circumstances and be inclined to comply with the instructions of healthcare providers. As a result, it is important that healthcare providers discuss religious observance needs with each patient. Some topics that healthcare providers may wish to discuss with their patients include articles of faith, removal of hair, cleanliness, dietary needs, and prayers.
Sikhs are required to wear 5 articles of faith at all times. This applies to both men and women. These articles are known as the 5 kakaras, or the 5 Ks. The first article is a kesh, which is uncut hair. The second article is a kanga, which is a wooden comb. The third article is a kara, which is a steel bangle. The fourth article is a karpan, which is a short sword. And lastly, the kashera, which is undergarment. Healthcare providers should ask for permission from the patient or the family before removing any of the 5 articles of faith. If it is necessary to move it during medical treatment, an alternative head covering should be provided. A surgical cap could be worn over the turban if necessary. If the kashera is required to be removed for an examination or treatment purposes, permission should be sought out from the patient, or accommodation should be made to allow them to be kept on one leg. Hair should not be removed from any part of the Sikh patient's body without consent from the patient or the substitute decision maker. The cutting of any hair should be avoided unless urgent life-threatening medical treatment cannot be carried out without its removal. Cleanliness is an important consideration for Sikhs. Sikhs follow a ritual of cleanliness and prayer each morning and evening. Some traditions of their medicine and remedies are: Sikhs may use a variety of traditional medicines and remedies, often in conjunction with medicine. Healthcare providers should inform patients about the origins of their proposed medication if it is delivered from animal and not suitable synthetic alternative assist.
Dietary needs. Many Sikhs are strictly vegetarians. A Sikh patient may wish to provide meals prepared at home. Prayer. Prayer is an important part of the daily Sikh routine. Prayers are usually said down before breakfast, in the afternoon, before sunset, and right before sleep, in any location, including the bed or hospital or prayer rooms. Visiting arrangements. Visiting Sikhs is an important part of cultural and religious practice, and Sikh patients may have a large number of visitors, including those from outside their immediate family. Community health services. Tobacco products, other intoxicants, or meat products should not be taken into Sikh homes. If this is not possible for workplace and health safety reasons, alternatives should be explored. End of life issues. Sikhs may wish to recite prayers and read scriptures when nearing death. Family and friends may wish to be present. Holy water from Sikh temple may be given for the patient to sip. Deceased patients. Healthcare providers should not remove any of the 5 articles of faith or the turban after death. The patient's family should be advised if it is necessary to remove these items. There is no Sikh religious objections to autopsies.
I'm Ivy Esguerra.
My name is Arismendi Tavares.
And Sabrina Grabkowski, and thank you for watching our presentation on religious beliefs and healthcare practices for Sikh patients.